Google Hangout on emergency preparedness. I'm Daniel Greenberg with APHA's Communications Department, and we are really excited to host this Hangout in celebration of Get Ready Day, in which APHA and public health leaders help Americans prepare themselves, their families, and their communities for all disasters and hazards, including pandemic flu, infectious disease, natural disasters, and other emergencies. Today's Google Hangout is a discussion about several layers of emergency preparedness, from how to prepare for health epidemics, yes, including Ebola, extreme weather, events, and mental health crises, all the way to active shootings. With me today is an excellent group of public health professionals, leaders and advocates who are going to share their unique perspectives, experiences, and best practices on emergency preparedness. Let's start by giving each panelist 1 minute to introduce themselves and share what aspect of emergency preparedness they will focus on. Jewel, I will start with you.
Thanks, Dan. I am Dr. Jewel Mullen, the Commissioner of the Connecticut Department of Public Health, and I am so privileged to be able to be with you today. As the DPH Commissioner, I get to work with an excellent team that has addressed a number of areas of emergency preparedness. Today, I will specifically be talking about how to prepare for health epidemics.
Thanks, Jewel. Jason, I'll kick it over to you.
Thanks so much for having me on. It's a real privilege and pleasure. I'm Jason Samenow from the Washington Post. I'm the Washington Post weather editor and run the blog, The Capital Weather Gang, which is a weather blog which focuses on communicating weather information for the DC area, but also covers national and international weather stories. Of course, we cover every type of extreme weather, from hurricanes to severe thunderstorms to major winter storms to flash floods. And of course, emergency preparedness and readiness is pivotal to be ready for these extreme hazardous weather events. So I'll talk to you today about some of the best practices to be prepared when these events affect your community.
And Jason, we're happy that the Washington Post knows about the importance of emergency preparedness. Jamie, I'll kick it over to you.
My name is Commander Jamie Seligman. I'm a project officer for the Substance Abuse Mental Health Services Administration, better known as SAMHSA. We're an agency within the Department of Health and Human Services, better known as DHHS. I'm currently in the position of the Division of Prevention, Traumatic Stress, and Special Programs, and working with disaster response, recovery, and assessment and preparedness. Today we're going to discuss disaster behavioral health with regards to disaster responder tools.
Thanks, Jamie. And last but certainly not least, Rich, if you could introduce yourself.
Hi, thanks, Daniel. My name is Rich Parris. I'm the Chief Security Officer for the District of Columbia Courts in Washington. My responsibilities encompass safety and security, emergency preparedness, protection of folks that come into our buildings, and I'm going to focus today on active shooter situations. So let's stay tuned.
All of you, and we're really excited that you could join us today. For our viewers, you can participate in today's Hangout by posting your questions on the Google Plus event page and/or submitting them through Twitter using the hashtag #GetReadyHangout. I'll be watching the feeds for your questions. The Hangout is being recorded and will be made available on the Get Ready website and APHA's YouTube page. All right, well, let's get this thing going. And Jewel, I want to start with you because we've been hearing so much about Ebola lately, which has claimed thousands of lives in West Africa. Different infectious diseases, including Ebola, measles, and MERS, are dangerous to our health globally. How can Americans take steps to prepare themselves for health epidemics?
I think that you're starting this question mentioning Ebola is a perfect public health reminder. It really is. And I just want everyone to know that true to our experience in public health, so much has changed since the time that we first started planning this hangout in the spring, because back then we were talking about a couple of different infections and the public's concern about Ebola hadn't risen to where it is right now. So I need to cover all of that very quickly. In fact, I think I'll start with where we were going to begin earlier on, which was talking about measles and the Middle Eastern respiratory coronavirus, both of which we had many more concerns about in the spring. And I mentioned them before I even get to Ebola, because I really want to remind people that sometimes we get extra concerned about the things that scare us the most, even if they're not what has the highest risk for us. So we've been watching really sad, concerning public health images from what's happening in Africa, in the countries that are affected right now, understanding that some of the reason that the epidemic is the way that it is because the resources to really manage an epidemic and help the public prepare and deal with it don't exist there. We have so much more capability here in the United States, and we're fortunate for that. So, for starts, I want to remind people that common things are common, because when we focus on the more remote events that our country is working hard to keep America prepared for, we sometimes let our guard down about the things that are more in our communities and a threat to us and in the background all the time, such as measles, such as the reminder that we're getting ready for another flu season. Therefore, basic public health messages, what we tell kids: coughs and sneezes spread diseases. I remember that when my kids were in elementary school. Careful hand washing, good hygiene, really, really important. We have a fantastic system for immunizing people against the most common conditions, which were responsible for a lot of epidemics when people my age were growing up before there were shots. So to make sure you're up to date on your shots, not just children, but adults, to get your annual flu shot. To remember that we have seen more cases of measles in this country in the past year than we have in well over a decade. Some of that is related to people who don't have vaccinations in this country getting infected. So, basic public health reminders. On top of that, the other thing that I would say is that we all look for information, and there's so much information out there. Seek your health information from sources that are up to date and well informed. Live with the confidence that there is excellent coordination between the federal, state, and local governments to continue to provide the best information possible for the public based on what we know at any given time. And that oftentimes is day to day. And then be prepared, because sometimes we can't plan what's around the corner. So make sure that you have your emergency numbers, the medications that you need, access to your doctors, and as I say, plan on the good day. Don't just wait for the context of a crisis. A lot of that's basic prevention. And part of my reminder is it's one thing to plan, it's another thing to be prepared. And this conversation helps everyone remember how to take steps for preparedness.
Thanks so much, Jewel, and I think that's such an important point that I want to get back to later on in this hangout about not letting our collective guards down. Just as a reminder to our audience is that you can follow this conversation through the hashtag APHA Get Ready. APHA Get Ready. Jason, I'm going to turn my next question over to you. Extreme weather events are scary no matter where you live in the U.S., from Alaska down to Florida and anywhere in between. So how can Americans prepare for any unexpected weather emergencies?
Okay, so let's start with, you have to have a trusted source of information. That's a key ingredient to be prepared, to be ready for any severe weather situation. So that could be your TV broadcast meteorologist, that could be the National Weather Service, or that could be an internet provider of weather information like the Capitol Weather Gang at the Washington Post. But you need to have someone you can turn to provide up-to-date, timely, credible information. There are a lot of fly-by-night weather operations out there. You might see something shared on Facebook which isn't reliable. So you've got to make sure that you're relying on a source which has provided credible information in the past and which has a good track record. Now, moving on from there, when you're preparing for a weather hazard or weather disaster, you want to have a plan. You want to have a plan with your family for before, during, and after the weather event. And so for extreme winds, for a tornado, for example, you want to make sure that you know that you need to go to an interior room at the lowest level in your house away from windows, underground if possible. You need to know where your shelters are, and you need to know where the safe places to be are. Likewise, for a hurricane or a flash flood, you need to heed evacuation orders. There's a tendency to think that this can't happen to me, and some people just want to hunker down and stay put, but it's really important when evacuations are ordered to, of course, follow those and get out of town and do so early so you're not stuck in traffic and potentially putting yourself in harm's way. Thirdly, you want to have an emergency kit for any weather disaster, and that would include bottled water, non-perishable food, a first aid kit, batteries, flashlights, any medications that you may need, as well as copies of any important documents. And batteries and a battery-powered radio is not a bad thing to have either. For winter weather cases, if you're going to have to be on the road during a winter storm, you want to make sure you have blankets and in addition to your emergency kit in case your car breaks down so you can stay warm until help arrives. Finally, and this is important in this digital age, before any mass power outage potential event, you want to make sure you power your mobile phones and your digital devices so you have them so you can get any important emergency information through social media, through Twitter, or however you're consuming that type of information during a disaster. You want to make sure that you charge those mobile devices before the bad weather hits so that you're plugged in and ready to go. So I'll stop there, but looking forward to the discussion moving ahead.
And Jason, have you had any weather emergencies at the Post where everyone needed to turn to their emergency stockpile?
We haven't had anything too extreme. But we did have in June of 2012 the derecho event, which was a massive line of thunderstorms, which was a mass power outage event here in D.C. And that kind of snuck up on us. But one of the things I emphasized was that people get any outdoor furniture inside their house so it wouldn't be a projectile and do damage to their house. I also emphasized that people charge those mobile devices because many people were without power for several days after that thunderstorm complex, that derecho event, affected the area. So fortunately, we haven't had anything too extreme here in the D.C. area over the last few years. The derecho event obviously stands out, and let's hope, knock on wood, the hurricane season remains quiet here along the East Coast.
Thanks so much, Jason. And Jamie, this one is for you because we've talked a lot about the physical toll of health emergencies, but health disasters also have impacted millions of Americans emotionally. Is it possible for us as Americans, as a country, to prepare for mental health events?
Yes, of course. Again, I always say prevention before intervention. And again, we have to prepare for these type of events, such as with regards to mental illness. A lot of times with disaster survivors is that they get upset when a disaster occurs or any type of disaster, that they don't have the resources, that when they're trying to speak to FEMA about their finances and talk to the insurances, it's so important to have your appropriate paperwork in order, such as your Social Security card, your insurance forms, valuables, get those jewelry waivers through your insurance company, because a lot of times insurance companies don't insure jewelry unless you get one of those riders. So it's really important from a medical and mental health perspective. making sure you have your medical records and your mental health records. And a lot of times for disaster survivors, they don't have that paperwork. And if they have that paperwork for that insurance adjuster, for that doctor they're seeing, for that case manager who's helping them out, it just makes it more challenging. With regards to disaster responders, I know that a lot of times the Red Cross would continually emphasize that the disaster survivor or the traumatic event survivor should have copies in different places. So again, it's very important to make sure you have the important documentation before that disaster occurs.
Thanks, Jamie, and we'll definitely be talking more about that towards the end of our conversation. Finally, I wanted to kick it over to Rich. Emergency preparedness is not something that we often think about in the court system, but it certainly affects you. No one expects to be involved in a mass gunfire, but events like Sandy Hook show us that things can happen. And that being prepared can save our lives. How can we ready ourselves for active shootings?
Daniel, I think the first thing that everybody has to get really well settled on is if the first time that anybody is thinking about an active shooter situation, when it happens, it's almost too late. It's one of those things that you have to think through from now about what I'm going to do, how am I going to protect myself, how am I going to get out if that's the thing to do, and what are my options. So the first thing that I would say to people joining in the Hangout, write this down. I got some homework for you. Write down 3 words: run, hide, fight. Again, run, hide, fight. In most situations, those are your 3 options. If you can get out of a situation, get out. If you're in a building and it is safe to do so, you know where the exits are, you can see the street, go. If you can't, if the gunfire is so close to you or it's coming toward you, find a place to hide. Find a place to secrete yourself. Find a place where you can barricade doors, turn off your cell phones, be quiet, and then fight. In the last and most severe instance, if your life or the lives of people around you are in imminent danger, convince yourself, steel yourself, prepare yourself to defend yourself with everything you have. Manufacture weapons, chairs, belts, fire extinguishers, whatever happens to be around you, and with sincerity and commitment, attack the attacker. You can get a lot of detail about this if you go to Google, Google in those 3 words I gave you, run, hide, fight, and watch the video that comes up. Run, hide, fight. Not just for the workplace, but at home, at the supermarket, at church, at school. It's something for your family to sit down and start preparing for. And again, if the first time that you are thinking about what you do in an active shooter situation is, hopefully it never happens, but if you find yourself in the middle of that event, you hadn't thought it through, your chances are not nearly as good as if you are prepared. Thanks, Daniel.
Thanks, Rich, and that's really powerful. I think will probably resonate with our audience. It's very, very difficult to teach people those 3 things. Is it something that that enough people know about? Do we know as a nation that we have, in an emergency, in an active shooting situation, that should be our recourse, is to first, if the first option to run is there, to do so, If that's not available, to hide, and finally, if there's no other alternative, to put up a fight. Do you think that that's something that enough Americans know?
I don't think that everybody that should have the knowledge of this has it yet, but I think the word is starting to get out. It's starting to get out primarily through the federal government and the federal government agencies. It's starting to get out through federal, state, and local law enforcement. I believe that, and obviously things like this is an unbelievable opportunity to spread the word to people at the grassroots. Run, hide, fight. You hear me say that over and over again. Go to Google, watch the movie. It's like 8 minutes long, and it's powerful, and you'll watch it over and over again so you understand what it's trying to put out and really get the word to everybody.
Well, Rich, we're going to try and make sure that our audience watches it. So we'll spread the word for you in that regard. And just as another reminder to the audience, if you have any experience with infectious disease, with a mental health crisis, or with running, hiding, and fighting in an active shooting, share your story with us through the hashtag APHA Get Ready. Once again, the hashtag is APHA Get Ready. So we're going to open the questions to the audience, but before we get to that, this is for all of our panelists, and we've heard about some of the great new tools that are available. We've heard Jason talk about Facebook. Rich, you've talked about social media a little bit, and things like mobile technology and social media are allowing millions of us to connect with each other in real time. How does this change the way we talk about emergency preparedness? And Jewel, I want to start with you because you've been quiet for a while.
Thank you, and thank you for talking about technology, because I wanted to go back to the point about using it and reliance on charging to be able to make sure your tools work for you. So let me just go back to how that relates in storms and a number of other disasters, because a lot of people rely on technology to live. They rely on technology because they're on dialysis, because they have oxygen and other machinery at home that requires electrical power and battery backup. So before I even get to the ability to communicate, I just want to remind people that part of preparing for a number of events is making sure that all the technology that helps you live also needs to work. Have backups. Talk to your suppliers so that if you know something is about to happen, once again, you're prepared. Identify the places where you can go for charging. We have found, though, that for communicating from the Department of Public Health to a lot of residents in Connecticut, being able to tweet, being able to use tools such as Text for Baby, posting things on social media, and relying on people to convey that message, those messages to their social networks, has really helped get messaging out around things such as carbon monoxide toxicity, or where WIC offices might be open for people who need to use WIC for nutritional support. So that's extremely, extremely important. And that's also very important because we know fewer people have landlines, but a lot of people have the power of a smartphone or that kind of capability with them. And I am not the media expert here, but we know that there are a lot of everyday citizens who help support those media messages and public health messages that need to get out.
Jewel, that's definitely the case. At APHA, we use social media not just every day, but every minute of our workday, and it's definitely an integral part of public health communications. Jason and Jamie, I know both of you want to talk about technology as well. So Jason, I'll start it off with you, and then Jamie, feel free to chime in afterward.
Sure. So let me begin by saying social media, with all its power, it does have the potential to mislead. And so you have to be careful about bad information which is out there. With weather, sometimes you'll have fake pictures, you'll have storm reports which are just made up. And so you have to make sure that the information you're following is credible and that it's coming from a trusted source. So I want to emphasize that point because we see it sometimes in weather emergencies. And in all emergencies, that there are rumors which spread, there's bad information which gets out there. So you want to, if something seems extraordinary, you want to double check it. You want to go to some other source of information and see, is this real, is this legit? And then the other point I want to make about social media and weather disasters is that, as plugged in as our society is right now, and even though most of us now, are checking our smartphones or watching TV or whatever, the people who are most vulnerable to weather disasters and the people who unfortunately are casualties of extreme weather events are typically those who are not plugged in. It's the people who are socially isolated, who are living alone, who may have cognitive impairments, who may be sick. So I think it's really important that those of us who are plugged in, we make a real concerted effort to reach out to our loved ones who may not be as connected, or and I think and this is more of a community challenge, that we really redouble our efforts to reach out to the vulnerable populations, the people who again are socially isolated and who are most vulnerable during these types of weather disasters.
Yeah, and that is certainly a great point. Jamie?
Yes, I would like to focus on our disaster responder tools. Being a responder means being prepared and working with disaster survivors. And I could tell you in 2004, for my first deployment, I wasn't prepared as I would like to be. And luckily, I had a strong enough team members to assist me with helping gathering resources and strong team leadership to assist me in those things I was not as strong in. Again, that's my first deployment, and before that, I did correctional mental health. So going from correctional mental health to disaster response and recovery is quite a big leap for anyone. So during that time in 2004, when we had internet inactivity during Hurricane Charlie, I was able to print out some tip sheets, and at that time I was working for Homeland Security, and I was actually printing SAMHSA tip sheets, which 3 years later I would work for SAMHSA. So it's just kind of ironic that I'm looking at these tip sheets 3 years later. I'm there. And one of the challenges was getting these tip sheets printed because we didn't, the power lines were down, the tower cells weren't working, and getting a printer as well during that time was quite difficult in a shelter environment. However, as time went on, I was able to get those tip sheets, and they were very helpful to use with disaster survivors and working with different agencies and other responders. In 2007, I came over to SAMHSA and noticed there was a that we had great information, but it was hard to navigate the website. And what we did was kind of like Amazon. We had all these single disaster tip sheets where you could click on all the tip sheets that we have and you could get them all. And again, that's what was called our SAMHSA disaster kit. Since 2010, we have shipped over 50,000 copies. And some of the disaster kit information, again, various publications like this. But when you're out in the field and sometimes where there's no connectivity, we had to move in the right direction with technology, and that's coming up with our SAMHSA disaster app. Everything that I showed you with our disaster kit is in now our disaster app, which is on iPhone, Android, and BlackBerry. And again, it's at the responder's fingertips. So if you're working with a specific population, such as children, you never worked with children before, I think it's important for you to preload that option where you can preload these tip sheets, and that there's no connectivity, you're able to get it. And I forgot to tell you, most importantly, it's free. The disaster app is free. So you could go to your iPhone, your Android or BlackBerry store, download it for free. This SAMHSA Disaster app. And most importantly, what separates our disaster app from other apps is we have our treatment locator embedded inside the disaster app. So if you're a responder, you're looking for community mental health resources, you put the zip code in, you hit search, and within a 5, 10, 15, 20-mile radius, you have all these local community mental health centers pop up that you can refer your disaster survivors to, and sometimes responders who may have compassion fatigue, or they just need a break and need to just check with their provider. These are great resources to have.
Thanks, Jamie, and that is wonderful, and I think I speak for all of us, and that's probably the wave of the future in terms of going app when we talk about mobile technology and social media, because that's where people are, that's what people are using.
And I would just like to state that from a fiscal perspective, it costs $9 per disaster kit. So we're saving a lot more money on hard copies. They're still needed in a disaster situation, but again, moving to technology is more cost efficient and effective for the federal government.
And that's what public health is. Public health is saving lives and saving money. So we're all about that. And once again, for our audience, you can follow the conversation using the hashtag APHA Get Ready. We just got a great question, and this one is for Rich. And this is following up on your run, hide, fight 3-word mantra for if you do face an active shooter. But we have a follow-up question. If you are in such a predicament, if that does happen to you, do you turn your phone off, or do you turn your volume down? And do you have any experience with this?
I'm happy to say that I do not have any experience being in an active shooter situation. The time to turn your phone off is if you are in a hide situation. That's not the time to be checking in with family. That's time to be barricading yourself in a room, locking the door, putting some heavy object in front of the door where people can't get in, and that's not the time to be calling home. However, the time to be notifying 911 if you are in a run situation is when you get to safety. I tell people in Washington, where we teach these classes, if we had an active shooter situation in the courthouse and you were in a run situation, you can get out of the building. Stop running when you get to Seattle. Don't just run outside, go to the corner, and stop. Get well clear of the courthouse, stop, dial 911, report the situation, and that's the time to use your cell phone.
Wow. Okay. I mean, that's just fantastic, and that's just something we cannot, and that we will be sharing on APHA communications channels. We had another question, Jason. This one is for you, and I quote, "I'm never sure how to adjust my emergency preparedness kit as the seasons change. Does Capital Weather Gang have any suggestions for which items are especially necessary from season to season?"
Well, sure. As I mentioned in my introductory comments, obviously, during the winter, you'll want to have warm weather gear available: gloves, hats, blankets, coats, especially if you're going to be traveling. I think that's when some people get into trouble, is when they're on the road. Maybe they get caught in a snowdrift, or the visibility drops to 0, and they're in a situation where they just have to get off the road and wait until the storm quiets down. So in those situations, you want to be sure that you're going to be warm, and also that you have your non-perishable food items so that you can stay nourished and hydrated. In terms of other times of year and how you adapt your emergency response kit, I think there are certain staples which you need all the time, and I don't think that's going to vary. Drinking water, food, batteries, flashlights. So I think in most cases, your weather emergency kit doesn't have to change too much. You just have to, obviously, if it's an excessive heat event, you might want to have a little bit of extra water on hand. And again, during the winter, you'll want to have more warm weather gear on hand. So I think a lot of that's common sense, but I think most of the time, your standard emergency kit with your first aid kit, your batteries, your flashlights, and your food should get you through most extreme weather events.
I just wanted to add, for if you have young kids, it's important to keep them entertained as much as possible. Flashlights, they love flashlights, they love cards, Uno. There's some of those basic childhood games, and books. That's always, parents love reading books to kids when they're scared and they want to be comforted, and that's a great way to do it.
Great point.
I'd like to add something there too. In Connecticut a few years ago, we had back-to-back storms, one at the end of August when it was relatively warm, and then Halloween in the same year was greeted with a snowstorm. And we, just by noticing what happened to people in the state and what they went to the emergency department for, got some other clues as to how we needed to remind people about the seasons. So even though people worry about the electricity being out, and we had hundreds of thousands of people without electricity in both storms, in August it was warm. So we had fewer people using generators. The issues that ensued once people couldn't get through in October, when we had power outages in places for more than a week in this state, were related to backups at the few gas stations where there really was gasoline for people to use generators, and then problems related to the use of those generators, both in terms of what happened with the air quality and contribution to more respiratory illnesses because of eroding air quality from all of the emissions, as well as increased numbers of carbon monoxide poisonings. So the other thing to remember that sometimes people forget about from season to season, because generators are so much more used in the winter than in the summer, is the secondary threats from these events that occur because people are trying to do okay at home. So I just want to put that reminder out there as well. I've really appreciated hearing Jason's recommendations. You could be working with us here in Connecticut. I know you have a full-time job, but so much of what you are advising people to do is also listed in our guide to emergency preparedness. This is not a commercial advertisement for Connecticut. Though it is available on our website, I think that a lot of my colleagues in other states also have similar guides, but it's all good advice no matter where you get it.
Thank you for that.
Yeah, thanks so much. Thanks, Jewel, and thanks, Jason. This is a great conversation, and once again, I in response, Jamie, to the disaster app and the social media resources that you provided, just wanted to remind our listeners that they can go to our Google Hangout event page to check out all of SAMHSA's materials, their disaster app. We really strongly encourage you to go check it out, and also, as Rich mentioned before, to check out the Run, Hide, Fight video that is on YouTube. Is that correct, Rich, that it's on YouTube?
That is correct. If you just Google those 3 words, it should be the first thing that pops up.
And to about face just a little bit, and this is to all of our panelists, because we talked about social media and mobile technology, but there's the flip side of that coin, and that's our senior population. So what about the population that does not have access to electronic devices, such as seniors who are alone in their homes? How do we reach them during an emergency? And I can open this one up to anyone, but Jewel, over at the Connecticut Department of Health, I'm going to start with you, and everyone else, feel free to share your 2 cents afterwards.
So Dan, your question really underscores the importance of a community response and community resilience. One of our local health directors said after one of our big weather events that it was only then when people needed to be brought to shelters, for example, or that we were getting calls that home health aides couldn't get to the homes of their clients, that they started to realize who else lived in their communities. So there are a number of ways to plan for that outreach, and I would say specifically through the state public health emergency preparedness programs that are supported through the U.S. Department of Health and Human Services. There's collaboration right now to help identify where people are located so that we know based on their medical information through their physicians and through Medicare, who's using oxygen, who's homebound, who's shut in. And we have opportunities to work with the home health care providers to identify people, check on them, make sure there are plans, and also start thinking about how, if those adults have to be taken to shelters, they need to be supported. But that's where, in addition to neighbor by neighbor, that advice we heard earlier about check on your family and check on your friends is so important. But we're at a point now where our public health system is allowing us to keep rosters of people, not to invade their privacy, but to make sure that we can get to them when we know they're going to need help.
I could just add that in the early 1990s and in the 80s, Philadelphia had a big problem with deaths from excessive heat events, and so they started a program where they worked with community and partner organizations. This was the Philadelphia Department of Public Health to greatly expand their outreach to vulnerable populations who are mostly older adults. And so they established a telephone hotline that provided information about extreme heat. They expanded their cooling center operations. They had a buddy program. They developed a database of those vulnerable individuals. So a lot of the things Jewel was just talking about, Philadelphia, in fact, did to address the problem of deaths from extreme heat. And they've seen unfortunately, they've seen the deaths from excessive heat go down as a result of those programs. So there are things that can be done, but it has to be a community effort, as Jewel said.
Yeah, we even have emergency medical service providers who will go door to door in high rises and check on people. And it gets very tricky because most people want to stay home. The community response also extends to nursing homes and hospitals that have been willing to shelter people who otherwise wouldn't want to be in a nursing home, but to just give them short-term support until it's safe for them to go home again. The other reminder there is that while a lot of older adults might be socially isolated, their closest social support might be their pet. So a strong community support also ensures that somebody's going to be looking out for their pets if the adults need to leave home.
Thanks so much, Jewel, and thanks for all of your great responses and analysis. I have one last question that I'd like to ask all four of you. How has being prepared made either you or your families healthier and safer? And Rich, I'll start with you this time.
That's an easy one for me to answer personally. A little short story. One of the things that I learned in flight school in the Army way back when, instructor pilot just pushed into your head. You had to know two things flying a helicopter. You had to know which way the wind was blowing, and you had to where you were going to put that machine down if your engine quit. Okay? I translated that as I got into emergency preparedness and just everyday life, actually, about knowing what's going on around me. For example, one of the things that I do when I travel, I'm here now in Erie, Pennsylvania, came in here last night into the hotel, got off the elevator, found my room, and the first thing I did was go back out in the hallway and count the number of doors between my room and the stairwell. Why do I do that? Because if at 2 o'clock in the morning the hotel is on fire, the fire alarms are going off, the smoke is filling the hallways and the rooms. You're down on your hands and knees. You may not be able to see that exit sign, so you're literally counting doors, 1, 2, 3, 4, until you get to what you know is the stairwell because you figured that out. That happened to me in Hong Kong. I was in a hotel, the hotel caught fire, I was on the 5th floor, and that saved my life because shortly after I got out of the hotel, the 5th floor was fully consumed with fire, and it was that habit that saved me. So preparedness, practice, habits, good ones, can and will save your life and the lives of those around you.
Thanks, Rich, and that's what that's if there's any message that we want our audience to take from this hangout, it's that preparedness can save lives. Jason, why don't I kick this one over to you? How has being prepared made you feel, or your family feel, safer and healthier?
Okay, so I might broaden this out just a little bit and talk about the real success story that we've had in the weather community as a result of better forecasts and better preparedness. And in the early 19th century, we saw a lot of lightning deaths. We saw a lot of deaths from hurricanes. We saw a lot of deaths from tornadoes. But over time, as forecasts have gotten better, as we've gotten better at communicating these hazards and the risks they pose, and as we've gotten better at telling people what they need to do to prepare, we've seen weather-related deaths across pretty much every type of extreme decrease. And that's something we need to keep working on because practically every single weather-related death is preventable. So through better forecasting, through better preparedness, and through better communication, frankly, we can continue to see these numbers go down and avoid some of these preventable deaths. So I will stop there with a big picture perspective, and just remind folks that you can follow us on Twitter at Capital Weather and at Facebook.com/Capital Weather, as well as on our blog at WashingtonPost.com/Capital Weather Gang.
We follow you on a bunch of our channels, Jason.
Thank you. It's great.
Thanks so much. And Jewel?
Okay, so what I would say is, given that these are really stressful events, any of these, and part of the stress comes from not knowing what to do. So my little story about how my family has been helped probably comes from our having grown up with my father being a World War II vet who worked for the post office. So between those two, there was nothing that was going to stop him because he was going to be ready. So we grew up with a model of somebody who prepared for what the weather was going to do or other events. And that's been instilled in me and all of my siblings, so that we check on one another. Even if we live in different parts of the country and we hear a weather report, we're checking on what's going on. We're checking on the people older and younger than us in our families, and we do plan and we prepare. And I think that helps us cope at the same time, because it's important to feel competent enough to deal with these issues. Part of the stress comes from feeling like you can't deal and you can't cope. So I think both our physical well-being and our emotional well-being has been aided by knowing what to do.
Thanks, Jewel. And finally, last but certainly not least, if you could share your story, Jamie.
Speaking of preparedness, we have what's called at SAMHSA our Disaster Behavioral Health Information Series, which looks at many different special populations, people with functional and access needs, and getting them prepared and getting the responders prepared to house these special populations is so important, because if you're not used to working with a specific population, they're trying to reach out to you. It could become more of a challenge for both the disaster survivor and shelter staff. So in our Disaster Behavioral Health Information Series, there's an array of special subtopics such as children and families, elderly, working with military families. It's important to get these disaster responders, the agencies, our community leaders prepared for these type of disasters and traumatic events. And to speak from a personal perspective, preparing my family for these disasters and traumatic events. My kids, I don't let them watch news, but they love watching the weather. So Jason, they're big. They love your weather channel, and they might not know what's going on with a particular shooting, such as Sandy Hook, but they'll know that the weather is 85 and sunny outside. So again, it's getting them prepared for these situations in life, and I think our schools are doing a better job with these drills, and it's so important to make sure that the media really concentrate on the facts and not speculate. So again, that's my personal story.
Thanks so much, Jamie, and thanks to the four of you, Jason, Jewel, Rich, and Jamie, for joining us for this really robust conversation today, and really important conversation. As a reminder to our audience, we have a new photo contest. If you go to APHA's Get Ready page and getreadyforflu.org/TOTS photo contest, you will see some really cute babies posed in emergency preparedness positions in our Get Ready calendar. Thanks to everybody for watching today. I'd like to thank all of our panelists. In closing, I'd like to go down the line and really give a sincere thanks to the Washington Post, to the Connecticut Department of Health, to the DC courts, and to SAMHSA. We can learn more about all of your organizations and what you are doing to promote emergency preparedness. And I'd also like to acknowledge the hardworking team at APHA for putting this together. For more information about Get Ready Day, visit APHA on www.aphagetready.org. Thank you so much to everybody for participating in this Hangout, and make sure to get ready.